Breast self-examination steps. Welcome to my YouTube channel. This is Alema Health Matters. Is this your first time? I urge you to subscribe to my YouTube channel, like this video and also share. You can also comment on the comment section and share your views about this video. Don't forget to click on the bell so that you will be notified every time I upload a new video. This episode objectives are breast self-examination steps. Women should begin conducting breast self-exams in their 20s. The reason behind doing breast self-exams is to be familiar with your body, because it's enormously difficult to say if there is a problem when you don't know what your normal is. So the more you are comfortable with your body, the better you are able to detect something new or different. That's why it's also important to conduct your self-exam at the same time every month, since breasts change over the course of your cycle. The last day or the week of your period, when your breasts are less tender. As you go through your menstrual cycle, the hormones in your body stimulate and affect the feeling in the actual breast tissue. Therefore, if you are doing the exam at all different times of the month, your breast exam will be different. Step number 1 in breast self-examination. Start by looking at your breasts in the mirror with your arms down at your sides or your hands on your hips. A visual examination is important because you won't feel if there is a skin dimpling, but you will see it. There are certain things that you will be able to visualize but not feel. Check for nipple appearance, nipple location, breast size, whether one breast has gotten larger than the other, breast, skin, whether there is a change to the skin of the nipple, is there a change in the skin color of the breast. If there are any abnormal changes, seek medical advice. The second step in breast self-examination, continue with your visual exam with your arms raised, looking for all of the same things as you were in step 1. A different arm position can make changes in the breast more obvious. For instance, if there is a mass in the breast and you put your arms up in the air, it may pull in. It may cause the skin to pull in at a certain region overlying the mass. Whereas with your arms down by your side, that may not happen. It's good to keep an eye out for fluid coming out of the nipples, but refrain from squeezing them in the process. The reason women are not taught to squeeze their nipples as part of the breast exam is that non-spontaneous nipple discharge, which only occurs when you squeeze the nipples, is somewhat normal. The third step in breast self-exam, after completing the visual exam, start your physical examination. You can stay in front of the mirror for this part or move to the shower or another location, as long as the location is always the same. So if you are most comfortable in the shower, make sure you do it in the shower every month. If you are most comfortable standing in front of a mirror, then do it in front of the mirror every month. Raise one arm. If you are examining the right breast, you should do it with your left hand and have your right arm or hand above your head. The reason for that is actually helps pull the breast away from the chest wall and allows you to appreciate the changes in the breast. Feel gently with your fingertips. The key is you don't have to press down firmly. It's a light touch. This should not be a painful experience. Follow the same pattern every time. Start at 12 o'clock, eye up on the breast. Use small circular motions and go fully round the breast from 12 o'clock to 3 o'clock to 6 o'clock to 9 o'clock and back to 12 o'clock. When you get back 12 o'clock, move in a little bit and do the same things again. The fourth step in breast self-exam, you can feel your breast in multiple positions, that is while lying down, sitting down or standing up, or you can just pick one as long as you do it the same way and in the same place each time. You want to keep this simple. It's a visual inspection of the breast and then the exam. Whether you want to do the exam standing or sitting, it does not matter. The point is to do it the same way every month. It's important to note that self-exams are not substitutes for clinical screenings. Mammograms are another important step in detection. While the guidelines vary, many experts say women without family history of breast cancer should get their first mammograms at the age of 40 years. Self-exams can still be valuable too in detection. Don't rely on them as the only two, however, and don't panic if you notice anything out of the ordinary. A healthcare provider can help you determine what's going on if you notice anything out of the ordinary. That is the last part of this discussion. Thank you for watching. Kindly subscribe and like this video.